Hello, I'm Dr. Judy Salerno, President of the New York Academy of Medicine. Thank you for joining us today for our Around the Table series, where we discuss issues related to health equity, the heart of our mission, with specific relevance to the times we are living in today. As we all know, discussion and exchange of information is critical, but so is taking action. After each program, we offer resources and recommend action steps you can take, all so that you can engage and help move us closer to our shared mission to advance health equity. We hope you will listen in, engage, and take action, because making meaningful change will take all of us working together. Our focus today is on promoting civic health. With the recent Supreme Court rulings on reproductive health and the many controversies around voting rights, it's important to understand how civic health can affect your life, those of your patients, and what we can do about it. While an individual's physical health can affect their ability to do everyday things, civic health affects communities and hinders progress toward improving social outcomes, such as equitable access to high-quality healthcare, education, and job opportunities. I'm pleased to be here today with Dr. Wayne Riley, President of SUNY Downstate Health Sciences University and the Chair of NYAM's Board of Trustees, and our special guest, Aliya Bhatia. Aliya is the Executive Director of Vot-ER that launched Civic Health Month in the US. At Vot-ER, she works to bring registration to healthcare settings, including emergency departments, hospitals, clinics, and community health centers. She was drawn to the connection between health and a healthy democracy through the combination of being raised by parents in the medical field and various defining experiences while studying, teaching, and working on housing and health initiatives. Welcome, Wayne and Aliya.
Well, thank you, Judy. It's a pleasure to join you and Aliya and to be a part of NYAM's action-oriented programming. Today, we're focusing on what all of us can do to affect change in our community's health, and also the important role medical and healthcare professionals can play in promoting positive civic health. Now, as Judy mentioned, this is the work Aliya has been doing for quite some time, quite impressively, I might add. So we are anxious to hear from her. From women's reproductive health care to COVID pandemic, the decisions being made by our leaders have a direct impact on the health of our communities. The effect of these impacts are felt in every aspect of our lives, from our closest interactions with friends and family to participation in our cherished democracy.
Thank you, Wayne. You're right. Civic health affects nearly every aspect of our lives. This can be seen across key indicators of civic health. For starters, social connectedness, interactions between friends, families, and neighbors. Community engagement, working with local organizations and fellow citizens to promote meaningful actions, social movements, and relationships, such as encouraging voting, discussing issues of the day, and participating in community activities. Community involvement, involving interactions beyond friends, families, and neighbors, including group membership, charitable giving, volunteering, and attending public meetings and town halls. And importantly, political action and participation, the way individuals influence local government and public institutions, including voting, contacting public officials, discussing politics, and buying or boycotting goods to reflect political opinions. With these indicators in mind, I'd like to bring in Aliya now to discuss the work she's doing with Vot-ER that is so much more than just voting.
Thank you, Dr. Salerno, Dr. Riley. When we think about our work at Vot-ER, it is always around the work we are doing together with other organizations. And we really see the New York Academy of Medicine as an incredibly powerful partner in this work that has already helped move the needle in civic health in America, and really grateful to be here with you. What I'm going to do is give a quick overview of some of the dynamics that Judy was just talking about, this health and voting relationship. I'll focus a little bit more on voting for the purposes of that overview, and also want to recognize and uplift that civic health is really about how people can inform collective decision making in their community, and that there are a lot of really important and different and distinct elements of that. Going to share screen and do a quick overview of the work of healthcare-based civic engagement as a way to explain and share a bit about this. I want to start in December of 2019, when there was a catalytic moment that ultimately brought me to Vot-ER. I had the opportunity in Atlanta, Georgia, my hometown, to go on a ride-along with the emergency medical services there. And the director of that emergency medical services was taking me to different parts of Atlanta where I was seeing EMTs and ambulances serving patients in their community. And I was really, as someone who's not a health professional, I was pretty overwhelmed by what I saw, because what I saw was health professionals responding to issues that felt like they were social issues, oftentimes responding to issues of homelessness, responding to issues of how somebody's insurance had changed, and as a process resulted in an emergent situation that required an emergency response. Seeing issues related to food insecurity in a community. And overwhelmed by all of these things, I asked the manager at the end, you know, if I give you a magic wand, you get to wave it once and it disappears, so you can only prioritize one thing. What's the one thing you would prioritize? And given my background, I expected, you know, some technocratic answer related to a social factor. And instead, what he offered was that if he could only do one thing, he wished his patients all voted. He said, if all of my patients voted, that would give them the capacity to have input into and create more resources for things like affordable housing, things like making sure there was a grocery store in every neighborhood, things like high quality workforce development. And it was about a month later that I heard about this organization, Vot-ER, and was able to join the work and be a part of it. Now, what he understood, this EMT manager really understood, is that health inequalities are the sum total of all other societal inequities. And so we see everything roll towards these indicators such as our life expectancy and the like. That life expectancy piece may in fact be a health indicator, but it comes from so many other social and political factors that come together. And interestingly, it's not, you know, just this EMT director who understood this. It's not just a professor at Harvard who, in the previous quote, understood this. It's actually something that most Americans fundamentally understand, that affordability of healthcare is a big problem. And we've seen some things in the political space over the last week that really demonstrates a coalescing of a feeling around that being a critically important topic. The other thing that this director realized was really profound, which was that the way that he would address the social issues he was seeing was to go further upstream to the political determinants of health. And in 2020, Daniel Dawes at the Morehouse School of Medicine released a book on the political determinants of health, and he put voting at the top as arguably the most important political determinant of health. And that's why our founder, Dr. Alistair Martin, launched Vot-ER. As an ER doctor, his patients were coming to him with issues related to these social determinants of health, not being able to afford food because of the cost of a family member's medications, losing insurance that covered their insulin, and he wanted to do something about it. And so he launched Vot-ER. In 2020, in the midst of the pandemic, we touched 48,000 patients and healthcare workers through our work. And ultimately, the 2020 election had record-breaking turnout despite the pandemic. I want to talk a little bit about how voting and health are related. And at Vot-ER, our vision statement is healthy communities powered by an inclusive democracy. In other words, we believe that if you want to see healthy communities, we have to ensure that the voices of those most marginalized in our health system are at the policy table. And we see evidence of the importance of this at the global level, the national level, the local level, and the individual level. So let's take a moment to talk about each of these. I want to start in Brazil. The reason I want to start in Brazil is that in the US, it's hard to really drill down to the causal impact of different aspects of democracy because it's different in virtually every county of the country. In Brazil, you have a unified election system that spans the entire country, which makes it much simpler to look at things like natural experiments that can impact specific voting patterns. A few decades ago, Brazil had an all-paper voting system that looked like what you see on this screen. There were hundreds of candidates who were on the ballot at any given time. And in order to vote, a voter had to go in and legibly write the name of the person who they wanted to vote for at the federal level and at the state level. Under this system, voters with less literacy often cast ballots that were thrown out for being illegible, and it was those most marginalized who were less likely to have their voice counted. Then Brazil decided to adopt electronic voting. And if you take a look at the version of the ballot on the right-hand side, you'll notice that there's a photo of the person you're voting for. You only have to remember a number. And when you hit the green button, your ballot is cast. This was a far more accessible system and increased the number of ballots that were counted by 10%. And in a part as a result of that, when you look at the difference between communities that got this voting system first, because they couldn't afford to roll out across the whole country at the same time. When you look at those communities that got this system first and those systems that got it 8 years later, what you see is a drastic difference in public health spending, which increased by 34% in those communities that had these voices represented, and also improved infant health outcomes measured as times that expecting mother went to see their doctor, or that there was low kind of measurement of low birth weight childbirth. That incidence decreased in these communities. Coming back into the US, where again, we have to look at this in a slightly different way. We do also see this as a pattern and correlation in the United States. We can't get as detailed of an analysis, but we can look at a few important relationships. And one of those relationships is between the cost of voting in each state versus health outcomes. This graph shows each state plotted based off of how easy it is to access the vote, the cost of how hard it is to vote, and then its health outcomes. And you see this correlation between ease of voting and stronger health outcomes. This correlation holds for a variety of health outcomes, including maternal mortality. And then when we drill down to the local level, you can see this in an even more granular sense. A professor at UCSD looked at communities where only a skewed, older, whiter homeowning population voted in local elections. And then he compared those to situations where more diverse communities voted in local elections. And I want you to remember that these local elections are often nonpartisan elections. Oftentimes, the majority of these local elections are going to be elections where people don't identify with a party. This is all about the number and range of people voting and how that impacts our policy. Well, it turns out that when more people vote in the US, we get a similar finding as in Brazil. Expanded turnout can increase the amount of funding going towards addressing the social determinants of health, these redistributive services, by a third. And if you sit with that for a second, you can forget the national parties, forget party and polarization, forget federal policy. At the local level, we can increase the amount of resources flowing to communities by having more diverse groups of people able to access and vote. If we can encourage individual voters to participate in these local elections, that does a better job incorporating their voice into local policy, we could significantly shift how politicians invest in the social determinants of health. And this is just one of a number of examples where you can see that in a more mapped out way, showing that the communities in Arizona with higher levels of social vulnerability are also the areas with the lower voter turnout. Finally, there's an individual level where voter participation is associated with better self-reported health. Now, what you could ask is, we could ask people to vote anywhere. Why should we do this in the context of health spaces? Why should we do this in the context of hospitals? And we went into 2020 with a hunch that healthcare providers are generally trusted messengers. We know this isn't universal. We know there are communities that have felt burned by decisions of their healthcare systems. But we had a hunch it would work, especially since our community of healthcare providers is such a very diverse group. And our early surveys from health professionals suggested they were reaching exactly the groups who generally don't vote, whose voice is not included in our democratic system, and that they were having wonderful conversations about voting. But what's really cool is what happened when we got our data back, because what this data shows is it validates exactly what we'd hoped to see. Not only did Vot-ER and our work touch more voters of color in the electorate, not only did we touch more young voters than are in generally the electorate, but ultimately these folks voted at higher rates than their peers from the same background who did not have the same intervention of a health professional talking to them about voting. Vot-ER did not invent healthcare-based voter registration. Community health centers have been doing this work for decades before us. They have a unique community-based trusted relationship with those patients. And one of the best documented examples is AltaMed in Southern California, a network of community health centers. And what they found in their work was for every 1% of people that they reached in a precinct, the turnout increased by 8%, which is a really incredible testament to the importance of healthcare-based voter access. And it's from that that Vot-ER was born, working with organizations across the United States, including the New York Academy of Medicine and many others. And then through that coalition, worked through the American Medical Association around formally acknowledging voting as a social determinant of health, which is a really powerful way to spread and expand this work. What does Vot-ER do? What we basically do is provide different tools, trainings, and community to health professionals to support this work, including healthy democracy badges and lanyards, posters and handouts that can sit in community spaces, and then supporting community health centers with SMS and EMR messaging directly to their patients. And as Dr. Salerno mentioned, there's also another piece here, which is that we need to make sure that physicians and health professionals are voting and making sure that they are also increasing their turnout, because it turns out that over the last 20 odd years or so from the data that we have, physicians voted at less than the general population, and it's actually gotten worse. Where it used to be 9%, it was then in the next study 14% less than the general population. So that is a bit about Vot-ER and the work that we do, and I'm really excited to dig into some specific and really interesting and timely questions that I know that Dr. Salerno and Dr. Riley want to talk through.
Great, thank you for that wonderful overview and for really setting the stage for our conversation. I'm interested in the AMA statement. Why is this acknowledgement important from a group like the AMA?
Yeah, we are so excited for what opportunity that opens up. The resolution itself is important. I think as important is who put it forth. The range of organizations that stood behind this resolution, which included the National Medical Association, included the Minority Affairs section, included the American Academy of Pediatrics, and a range of other health organizations at the AMA, demonstrated the range of support to make sure that voting and political voice are a part of our dialogue about what is important to health. And we already see the impact of resolutions like this one on other organizations. And an example is that the Association of American Medical Colleges has now put out a fact sheet around how to push forward voter access within medical school spaces. And that was catalyzed by the AMA resolution, in part making it possible to push forward with other spaces.
Yeah, Aliya, just to follow up, the last two slides, you had some research that indicates that physicians don't vote by and large. And you know, this is rather sobering if you think about physicians, you know, being among the best educated of all Americans, but yet as an aggregate or as a group, just don't have high levels of voter participation. Why do you think that's so?
Those two studies, interestingly, don't go deep into what the reasons are for the lower level of participation. But a hypothesis we've heard a number of times is just how busy healthcare professionals are and physicians are in their work. And that's why in our work at Vot-ER, you know, our mission statement is about exponentially scaling voter access within the healthcare system, which includes nonpartisan voter registration, but also nonpartisan vote at home resources, where we can make sure that health professionals can get their ballot and vote on their own time. We're also working with a number of our partners to explore long-term what it looks like for their organization to be a space where voting can happen directly. And actually, AltaMed has already piloted this in Southern California. But if the challenge is that people need to be close to the space where they can vote, one way to do that is to put more access to the vote in community spaces directly, such as health institutions.
Great answer. And you know, that does track you know, the low level of even philanthropic giving among physicians. That's sort of interesting. It almost parallels that physicians as a group tend to be a little less philanthropic than other sectors and other professions. So that's fascinating work.
So, Aliya, we saw a tremendous voter turnout in Kansas, motivated by a specific issue around reproductive rights. And I know that Vot-ER's efforts are nonpartisan, but were you active in trying to get out the vote in Kansas? And how does that square with a nonpartisan perspective?
Excellent question. So Vot-ER we work in all 50 states. What we primarily do is provide tools, trainings, and community. And we have a number and have long had a number of partners in Kansas. In 2020, one of our earliest partners was the Kansas Hospital Association, which encouraged their hospitals all around Kansas to get engaged in Vot-ER's work and voter registration. So that laid a lot of groundwork for voter registration work. And then what we saw in the most recent, couple of months was that our partners who were on the ground, the Kansas Hospital Association, community health centers, were able to leverage resources to make sure that there was high turnout in that election. One of the things that is so critically important is that when you're going to make a big decision about something like reproductive health, you don't want that to just come from people who usually show up in primary elections, which is such a tiny portion of the population. You want to make sure that decision is truly made by everyone whose life is going to be impacted by that decision. And I think a number of health organizations on the ground felt that given the extent to which that particular topic was going to touch the care that they could provide, that it was critically important that they make sure that the voices of their patients were factored into that. So it was exciting to see the record level of turnout in that election, and for us, making sure that as many voices are heard in those types of decisions is exactly the type of work that we want to be doing.
There's no downtime between the primaries, the fall elections, and then the 2024 presidential election is already off to the races in some respects. So, so you keep busy year round. And do you ever focus on local races?
Yeah, we actually put and I think that's part of why some of our partners in Kansas lead into this work. We are really of the belief at Vot-ER that so many of the decisions that impact people's lives are going to be local determinants of health. And so we have put a lot of thought into how we craft the relationship between a provider and patient around voting to really focus on those local issues. This is also really important because at a practical matter, when we're talking about the power of a person's vote, I don't know how it is in New York. I do know that in some places in some states, a person might say, well, I know what the federal result of my vote is going to be. It then becomes extremely important to convey that may be true, right? There's very valid that you may know how your state is going to go, for example. But it turns out that a lot of the decisions related to the quality of water in your community, and whether there's lead in the water, whether there's green space and available green space in your community, the placement of different refinery or chemical related facilities, those decisions are going to be made by the very hyper local level. And those decisions in elected officials are going to be chosen by a couple hundred votes. So really having those conversations with patients has always been the way we've approached this. And we really think that it empowers people to use our tools when an election's coming up that is very specific to a local health issue in their community.
Yeah, Aliya, in terms of, I could hear some voices of skepticism out there amongst our physician colleagues, and their skepticism would be framed like this. Is it really good business for medical practices to encourage patients to vote? And how might we consider answering that?
We actually, Dr. Riley, we actually usually find the reverse, which is that for health professionals, where talking about COVID or monkeypox doesn't get at some of the foundational issues that then resulted in these other conversations about health, that those conversations can be incredibly draining when a health professional doesn't feel they have the tools to address the systems and factors that got us there. And what we found is that health professionals who participate in Vot-ER feel that work helps energize them around the rest of the work that they do. We do a lot of conversations with our professionals to check in, see how things are going. And one of them commented that Vot-ER helped them do what they'd actually set out to do in medicine, was to make sure that they could care for their patients. And the feeling of not having the ability to do that within the parameters of the day-to-day work that they do had been weighing on them, and that Vot-ER gave them an outlet for that. We do, deeply believe that Vot-ER's work should be non-interruptive, nonpartisan, and completely optional for both patients and providers. And so as a result of that, we don't want a person for whom it feels like a weight on them to have to introduce that into their medical space or conversation. But we also do want it where those who do feel that it's a helpful part of their social history can introduce it as well.
And then, Don Berwick, as you know, somebody I know whose work you've read and probably admired, like all of us in healthcare, wrote a wonderful commentary in the Journal of the American Medical Association back in 2020 about the quote unquote moral determinants of health. And you spoke earlier about the Dawes work around the political determinants of health, which I think are very excellent points. But how can you speak about the moral determinants of health and its role in terms of voting and healthcare professionals?
We are really lucky to have Don as one of our advisors, along with Dr. Salerno, and love how his moral determinants framework really brings into sharp relief the challenges that we are facing today. Over the years, the framing of the social determinants of health has been a really important way to unpack and understand some of the underlying dynamics of what's happening in our patients' lives beyond the clinical space. And also, as Don points out, we haven't yet gotten to the magnitude of action and response that it will take in order to address those social determinants. And so, similar to Daniel Dawes and this thought about political determinants being upstream, what I really think is helpful about the moral determinants is how it points out that voting access for both health professionals and for patients is a critical part of addressing these social determinants, in addition to the technocratic questions of how policy and health professionals can shape those social determinants. But there are other components that get to the moral underpinnings of the profession and what it can do.
Well, Aliya, I recently spoke to a group of medical students and was talking to them about Vot-ER and about this as a social determinant of health. And it was so interesting. They immediately got it. And they were very excited about thinking of integrating this into their roles as clinicians. And I wonder if Vot-ER attracts more younger professionals or professionals in training who are more exposed to perhaps some of the shortcomings of the healthcare system on a daily basis, rather than those of us who have moved into administration in healthcare systems. What's your view of that?
We do have a lot of medical students and a lot of folks going through residency in their residency program. That is definitely a huge component of people using directly the Vot-ER tools. What we find incredible, though, is the level of allyship of those medical students and residents with leadership who may be in a different generation or older, and the extent to which that leadership fills a different part of the role. It's as important for there to be backing for the moral determinants of health as there is for there to be implementers of the intervention around voter access. And so, we know in Vot-ER that the same folks who might use our tools more directly, that's one part of our coalition. But the entire range of who is in healthcare and medicine are involved in Vot-ER in some way across professions, social worker, nursing, medicine, and across sort of both generational components within Vot-ER. And some of the people who have trailed the path for our work are those who have tried it, done it, seen where the issues and the quirks were, and then helped us to work through those things. So I think it's a both and there, and we're incredibly grateful for the energy and dedication that those medical students bring to the work.
It's all very exciting, and we really appreciate your work, and and the progress you've made in such a short period of time. I know that you launched several years ago, August of every year, a Civic Health Month. And I know that's caught on like wildfire, and it's great to see so many different kinds of organizations saying that they are going to do something positive toward civic engagement during August and carrying it through the year. Can you talk a little bit about what happened this year and what you see as the future for Civic Health Month and Civic Health year-round activities?
Absolutely. Civic Health Month is a time where we have the opportunity to connect and uplift the relationship between voting and health. The reason that's so important is when we look at moments of skepticism in democracies around the world and in the US, the skepticism in part comes from, well, what does democracy do for me? What does democracy do to actually support the things that are happening in my life, that are impacting my family? And the opportunity of Civic Health Month is to really draw those connections between voting and a thing that we all understand fundamentally, which is our health and its impact on our life and our community. What's incredible, as you pointed out, Dr. Salerno, is that it's not just health organizations that get this. There are organizations that have been working on other social determinants of health, like the United Way, that also get this and think of Civic Health Month as a way for them to engage and participate. And what we are so excited about this year is that on the 1st of August is when the Association of American Medical Colleges released their guidance around what medical schools should be doing this month and beyond. We're excited that the week before, the governor of Massachusetts, along with the Secretary of State, a bipartisan group of people, put out a proclamation around Civic Health Month. And so we're really excited about the level of support and dedication that there is out there to really connecting these issues in a way that resonates with real people in their lives. And that way, by the time we get later into the fall, whether it's September, October, November is traditionally thought of as an election time, but frankly, elections happen year round. With August as Civic Health Month, it's already top of mind for people in a way that gets them closer to going from intention to action around voting come November general elections.
Well, Aliya, this conversation has been, I think, very illuminating. And, one of the things we try to do as the New York Academy of Medicine is not just think about issues of the day that relate to the health of communities, but also to try to think about what each of us can do on an individual basis. In other words, the action agenda, as you will. And so, this discussion has generated great ideas and great discussion. And, I think it's appropriate that we remind everyone to click the link at the end of the program to learn about a number of other resources and information that we have at the Academy for you with regard to how you can be engaged for the health of your patients and the health of New York City and the health of the country and indeed the world. And also we encourage those who see this to put recommended solutions and actions shared today into practice, discuss it with your peers, over a glass of wine, cocktails in the doctor's lounge, at the yoga studio, in the carpools. We know a lot of health policy work gets done in those rarefied circles, Aliya, with busy healthcare professionals. So, and then again, we always challenge our membership and those who care deeply about our mission to, what can you, what can I, what can we do to shape a better future with regard to the health of New Yorkers and the health of the country. So again, don't be bashful about sharing these messages. I think even this discussion, sharing this great discussions we've had with Aliya about voting and its connection to health. Some people will not immediately get that connection, but after listening to this discussion, they can then see there is a clear nexus between voting and health. And one of my great sort of exemplars of that, Aliya, is about Medicaid expansion In certain parts of the country, Medicaid has not been expanded because of political leaders who were elected and who did not subscribe to the notion that one of the things we can do to assist people with healthcare disparities is to get them some level of insurance, even Medicaid. So to me, that is the omnipresent example of how voting makes a difference in terms of health, that in certain parts of this country, it was political leaders, not health leaders, who made the decision not to expand Medicaid. So here again, yet another, a rip from the headlines, if you will, manifestation of what you and this great project are trying to create with regard to the strong connection between voting and the health of the public. So Aliya, final words from you.
Vote this fall. Register your patients to vote and remind them to do that. And remember that this is something that happens year in and year out, and that many of the most important elections fly completely under the radar, and that every patient's vote is going to make a difference in all of these crucial local elections. So thank you all. Really, really honored and grateful to be here. We, like I said, are incredibly grateful for the partnership of the New York Academy of Medicine, and we're constantly learning from y'all and are grateful for the opportunity to continue to expand the work together.
Well, keep up the good work, Aliya.
Thank you so much. And we'll be back soon with another Around the Table. And we thank everyone for participating. And remember, take action.